February 4th is World Cancer Day, and joining us in the studio, we have Dr. Emily Cassidy of Our Lady of the Lake to talk about ways we can be more preventive and healthy in our lifestyles. Dr. Cassidy, thank you so much for joining us in the studio.
Thank you so much for having me.
So a major question that people and individuals usually have is, how can I lower my risk of cancer? Are there any steps that I can take to be preventative?
Of course. I think, we see an abnormally high rate of cancer here in these southern communities, and I do think that part of it is lifestyle related. I focus primarily on lung cancer, so the most obvious thing that I see from, my day-to-day work is tobacco use. So smoking cessation efforts, I think, are being, really kind of highlighted and put into place to help our folks that are still struggling with that tobacco addiction to cut back. But certainly all cancers, health in terms of your exercise, your nutrition, alcohol, tobacco use, all of those things are really important when it comes to cancer risk.
Things that we take for granted or things we think we can just go about doing, but your health really does matter in the long run.
Absolutely.
So what role does early detection play, and are there any screenings that people should be aware of?
Oh, for sure. So, when we think about the survival of lung cancer and the treatment options that are available, the survival is always going to be better when you capture cancer at its earliest stages. So a stage 1 lung cancer behaves very differently than a stage 4 lung cancer, for example. The problem is it's more difficult to diagnose those cancers at earlier stages because they tend to be asymptomatic. So that's where screening comes into play. Screening means you're not having any symptoms at all, but just because you're high risk, you're going to get annual testing so that if something comes, or develops in your body, you capture it before it develops symptoms. So for lung cancer specifically, that's annual CT screening. And that's done for patients who are at high risk for lung cancer, at no charge. It's not an invasive test. It's just getting a CT scan once a year. And it's analogous to mammograms for breast cancer or colonoscopies for colon cancer. But keeping on top of all of those things at regular intervals is really the way to capture cancers when they start off, and that typically leads to a much better prognosis and more treatment options.
So when you go to your doctor, can you just get screened or just check in if you don't know? So do you just ask for screening?
Yes. And most primary care doctors, once you hit those age milestones, will have that discussion with you. Lung cancer screening specifically is the less well-known one. So patients do sometimes have to say, am I eligible for lung cancer screening? Can I go ahead and get that test? And we certainly accept a lot of self-referrals for lung cancer screening as well. But yeah, you really do have to be proactive. I think, doctors are doing their very, very best to remember all of your medications and all of your history and all of those screening things, but you are your own best advocate. So taking ownership of your own health and staying on top of those things, ultimately, it's going to affect you and your family more than anything.
And are there any treatments or emerging therapies that are here that can show promise to the fight?
Absolutely. So I'm a surgeon, which means I get to play with all of the cool toys. And, as technology has advanced, it has completely shifted the way we do things with regard to cancer surgery. We have such better technology and it gives us more precision. We're able to do these big operations through very small incisions and with better visualization and more precise movements. I think what all of that leads to is better outcomes for the patient. We are able to get the entire tumor out and with an easier recovery. An easier recovery is always going to allow more patients the opportunity to undergo surgery. So I think we're really seeing a shift in terms of our surgical modalities, the way we can biopsy these things. But even on the medical side, there's new drugs, new targeted therapies, immunotherapies, all of these different options that were not available 10, 20 years ago. And it really is changing the landscape of what we can do to help attack cancer.
And in the event that someone does end up in the fight, what support systems should people consider when they're going through treatment and going through recovery?
I think your best support system is going to be your family. Always, for just about everything that's going on in your life, your family, your friends, your people who have known you forever. I think that's part of why it's been so rewarding for me to set up my practice here close to home. I'm close to my family and friends, and my patients are too. And I think what we've been able to offer patients is world-class therapy close to home, so that you're not having to travel a long distance and be away from your support system while you're undergoing these sorts of treatments and fighting your fight. So being able to have that close to home and close to support is huge. For those who may not have the family or friend support, there are certainly tons of other things that are out there. There are websites, there are support groups you can find. There are virtual cancer living rooms, where virtually you can log in and discuss your issues with others who are going through something similar. I think that there's a world of opportunity there for us to support each other through it.
That's amazing. And you mentioned that you're close to home. I know you work for Our Lady of the Lake in 2 locations. Tell us a little bit about that.
Yes. So I have offices at Our Lady of the Lake main campus in Baton Rouge, and also an office here in Ascension Parish. So we're seeing patients at both locations, all week long, and really with the goal, again, of being available to get people in sooner, early detection, early treatment. We know that that's the key to all of this.
And if you have to leave our viewers with just some encouraging words when it comes to cancer, comes to health, comes to supporting that we are stronger together.
Absolutely.
What do you have to say?
I think my takeaway would be, it's easy to want to bury your head in the sand and not seek medical care or not get screening tests and say, well, I feel fine, I am fine. If I have cancer, I don't want to know about it. I hear that as an excuse all the time. And I think as the person who's on the other side of that, I can tell you, if you have early stage lung cancer, you do want to know about it. There is so much you can do to just get rid of that lung cancer and continue to live a normal, healthy, happy, fulfilling life. It's not a death sentence, but it is something that you need to address proactively and quickly, because if you wait, the options become fewer and fewer. So I think being proactive, taking ownership of it, and you're worth it. You're worth it. You think about all the things that you do for yourself every single day of your life. Take care of this. Nobody's gonna shame you or fuss at you. We all just want to help.
We all just want to help. We all just want to be supportive. And you have done just that by coming in and sharing this knowledge with us and our viewers. Thank you so much, Dr. Cassidy, for joining us in the studio today.
Absolutely, my pleasure.
And like Dr. Cassidy said, you are worth it. Whether it's showing up for your health or showing up for others, we are stronger together. We'll see you next time in the studio.